Hello everyone, welcome to this knee pain rehab video. As you know, with a lot of my videos, you need minimal equipment, but for this video today, you do need some sort of lacrosse ball, golf ball, tennis ball, because there is going to be a little bit of myofascial release, a little bit of foam rolling, just to free up certain areas that might be impeding knee flexion. Let's get stuck right in. I'll talk while we do the first position. First position is going to be a lizard lunge. We'll start at the top of the mat, bring right foot to the outside of the right hands, kick the left leg back, and we're just going to hang out here. Might be thinking, oh, surely this is hips, this isn't knee pain rehab. A main part of lower limb function is having a good amount of mobility in the hips, so this is where we'll start today, just to try and take the pressure off anything that might be annoying the knee. With this position here, you're going to feel it front of the hip and the back hip also. There are many differential diagnoses when it comes to knee pain, but with a lot of them, knee flexion will cause pain. So that's whenever you're trying to bring your heel to your glutes, bending your knee essentially. So today's short video will be about making knee flexion less painful, so we can start to load up and move our bodies again to live pain-free and happy. This position, we're going to count down a couple more seconds. So we're going to go 5 in, 5 out. And these are inhales, exhales. 4 in, 4 out. 3 in, 3 out. 2 in, 2 out. Stay nice and active in this, pushing into the tips of the toes. Last one, 1 in, 1 out. Make your way back to quadruped position, all fours. Then we'll do the same on the other side. Left foot is coming to the outside of the mat to meet the left hands. Right leg, come up onto the balls of the toes. Hang out here. So no matter what diagnosis you have when it comes to knee pain, just try and load up as much as you can in a pain-free range of motion. So say, for example, as we move through the next couple of exercises, if things do get a little bit sore and do tend to flare up certain structures in your knee, just decrease the range, come out of it a little bit, see how it feels. If it feels good, go back into it. Listen to your body always. It will communicate with you whenever you're pushing things too far. And again, working this opposite hip. Count down with me. So 5 in, 5 out. 4 in, 4 out. 3 in, 3 out. 2 in, 2 out. Last one, 1 in, 1 out. Come down onto the hands, bring the feet back. Now we're going to utilize this golf ball, tennis ball, lacrosse ball, do a little bit of myofascial release. It does tend to roll around the room, so you might need to relocate it every now and again. But we're going to start with the right hip, because that's what we did the first stretch on. What we're going to do here is lie back supine. What you're going to do is find a little bony landmark here in the hip. Then we're going to move slightly down the way till you find this good bit of meat, this bit of muscle here. You would call that sort of moving distally down the way. What you want to do is find a bit of meat to work with, and you're going to put the lacrosse ball on the outside, and then you're going to use your body weight to lean in to the lacrosse ball. It might feel better to put it on the outside of the bony landmark or further south. You just have to find what's right for you. And if it feels uncomfortable, that you want to run away and you start making little bits of apprehension facial expressions, then that's when you know you're in the right spot. And the main part of myofascial release is not getting in and grinding and trying to push it. You want to relax in this position. So 5 breaths on me, 5 in, 5 out. With each breath, move deeper and put more of your body weight into the crossbar. 4 in, 4 out. 3 in, 3 out. 2 in, 2 out. 1 in, 1 out, and then come out nice and slowly. Doesn't matter if you have to fidget around and try and find, somewhere that's right for you, because everybody's different and everybody has restrictions. So fidget about and try and find that sweet spot. And once you do, just relax and breathe into it. Gonna do. Oh, wow, we're gonna do the same on the other side as well. And what this is going to do is going to free up the hips. So again, find that bony landmark. I like to go on the outside. Once I'm on the outside, I lean my hips over. This side doesn't feel as sensitive, so I'll try and go a bit lower. Don't really feel much there. Go a little bit higher. Yep, there we go. Apprehension. 5 breaths on me. 5 in, 5 out. 4 in, 4 out. 3 in, 3 out. 2 in, 2 out. 1 in, 1 out. Come out nice and slow. Well done. Now that we've taken care of a little bit of myofascial release, we're going to come into a strengthener now. So you can't fully bend your knees. Squatting, it's not applicable for you right now. So we're going to do isometric strength. Go as far as you can with a narrow stance, okay? If it hurts when you come the whole way here, past 90 degrees, don't go the whole way 90 degrees. Slight knee bend. We're going to hang out here. Feel the quads firing up. We're teaching the body that it's okay to use the musculature in and around the knee. If this is too easy, shift your weight over to your left and hold. 5, 4, 3, 2, and 1. Right foot down, shifting the weight over to the right side, keeping that same degree of knee bend. 5, 4, 3, 2, and 1. Over to the left again. It's getting a bit more challenging now. 5, 4, 3, 2, 1. Shifting again. 5, 4, 3, 2, 1. If that's too challenging for you, just hang out in this position. Keep the contraction on the whole time. For those that are feeling strong, feeling good, we'll do a couple more rounds. 5, 4, 3, and see how the knee is working hard here to stay nice and stable, nice and balanced. Works on that proprioception of the joint as well. You get compromised proprioception with a lot of ligamentous injuries in the knee, so a lot of ligament injuries. 5, 4, 3, 2, 1. Lovely. Last round. 5, 4, 3, 2, 1. 5, 4, 3, 2, and 1. So let's keep her lit with the strengthening components of knee rehab. Make your way down to a supine position. we're going to strengthen up the glutes and the quads here, okay? So we're going to lift up into hip extension and hold here. If this is too easy for you, you can swap to one leg. If you want to challenge yourself a bit more. But we're going to hold here for a couple of seconds. Really feel the glutes, really press into this region here to figure out, right, okay, we're firing on all cylinders here, right versus left. Driving the hips up. We're comfortable here, so we'll go left, right, little marches. We'll do this for 5, 4, 3, 2, 1. Send the hips up again, hold. Like I said, you want to challenge yourself a bit more. Switch over to the left side, 5, 4, 3, keep sending the hips up, 2, 1. Right side, 5, 4, 3, 2, 1. Straighten the marches. We'll go 5, 4, 3, 2, and 1. Back into the double bridge. When you do constant repetitions with little rest, it's a nice easy way to challenge the intensity with minimal equipment because there's constant muscular tension. And then send them hips down. Should have felt that glutes, quads, and sometimes even the erector muscles of the lower back. Now that we've done a little bit of strength work, we're going to go back into our myofascial release. This time we're going to go directly on the quadriceps region. These muscles are important for knee extension. So make your way down to your prone position. What you're going to do is you're going to place the lacrosse ball away from the bony landmark of the patella, and you're going to put it onto a sensitive area on the quadriceps grip, similar to how we worked at the hips earlier. So it's going to be different for everyone. Find that spot that feels a little bit uncomfortable. Look for that apprehension. There, perfect. We're going to hang out and breathe for 5, 4, 3, 2, and 1. I like to keep a slight bend in this knee because a lot of times people work on the quads when the knee's extended and contracted then. But it just creates unnecessary tension. From here, what we're going to do is we're going to extend the knee slightly. There's 1, 2, 3, 4, and 5. Nice. Bring it back to that starting position. Just a little bit of active release here. If this part, if it gets too easy for you and you're not feeling a good sensation, play around with it. Try and figure out where the ball needs to be, and your body will let you know because it'll feel a little bit more tender. Same again. 5, 4, 3, 2, and 1. What this does is takes off any unnecessary tension around the quad and then around the knee. So think of this as almost decompressing the muscular structures around the knee that might be holding on to any excess tension. We'll hold this position again. 5, 4, 3, 2, and 1. And then pop onto your side. Let that massage ball come off naturally. Perfect. Same again on the other side. So I'll come to this side so you can see what we're doing. And your placement of the ball might be different left from right. I know mine is. For this side, I feel like towards the knee is a little bit better. So I'll bring this up. Let the body weight naturally push down. We're going to hold this for 5, 4, 3, 2, and 1. Now it's okay to feel the pain or discomfort sometimes radiate, because it can radiate into different areas of the body. So we'll do little pumps. 5, 4, 3, 2, and 1. Lovely. If it gets too easy, feel free to shift. Find a good area of tension. There we go. Little pumps. 5, 4, 3, 2, and 1. Whew. That is nasty, but takes any muscular tension off the knee. It's going to relieve the pains for a good while. So well done for showing up today and taking the first steps into rehabbing your knee pain.